4-5 months, we do a pre-assessment. There's a set of questions which we conduct with the mothers, with the clients, and then after the education is over, then we conduct again with a gap of 1 month to see if there's any change in the knowledge, and in some cases, if the change in the behavior. So we do have this study, formal study on anemia, which is available to show what are the areas where there were significant changes in the knowledge as well as behavior. What happened? Yeah. Okay, go to the next one. In terms of health linkage, so this was something we started last year. Okay, let me continue with this. So in terms of the health linkage, one of the reasons why we introduced this is because of strong education. There has been demand, but unless there is access to the services, it won't have been very useful. So we really followed it up with the government and especially with the health sectors. For both the partners, their approaches were a bit different. As far as ADS is concerned, since they have a very good relation with the panchayat in the area, so through panchayat they could manage to converge ICDS sector as well as the health sector. They had informal relationships long back, but this time it is very formal. And as a result, yeah, it's okay. As a result, what they did in terms of the linkage, they managed to have ICDS and health frontline workers like ASHA, A&M, Anganwadi workers to participate in the regular health education that ADS did. They also conducted joint home visits officially. So they have been doing it, they've started doing it. And the ADS people are regularly attending the 3rd and 4th Saturday meeting, the convergence meeting that happens in the state of West Bengal. 3rd Saturday meeting, all the stakeholders are there. And the 4th Saturday meeting, along with the sectors, ICDS and health, they also have the panchayat. So there they can actually review and provide their feedback. So that's for the health linkages. Go to the next. Coming to another intervention, that's health savings. Of course, we've been talking about insurance, but this is basically health saving, which is again an addition to the normal or regular business savings that these groups are doing. In this case, again, this is something which ADS has started operating last year. So now, in this case, what I just want to highlight here is the focus is on petty expenses. Sometimes, you know, just the travel expense or buying medicines, these take a lot of, you know, whether it's 500 rupees, 1,000 rupees, sometimes it's very difficult for this woman. So they developed a separate saving method, and as I've pointed out here, it's unbanked box method. So this savings is not linked with any bank. They're keeping it in a box, having 3 different locks, with 3 different keys, with 3 different women, and the box is with another woman. When they meet, they have their regular business activities, they have the regular savings, but then they have this health savings box. 3 women, they open the keys, and they have this, you know, these things is there in the picture. And they keep the savings, they give them as a loan. There is also fine if you don't repay. There's also fine for late attendance. All those things are there so that they can grow that amount. And Sudhir of ADS may be able to tell you what is the exact number of the women who are involved, what is the savings currently, all this. But that's the model they have used. This is what we previously used in Africa. from freedom from hunger, and also here in India, Aikyatan Foundation did this for Nidan in Bihar. So we took that particular model. We have our own education system of how to introduce this kind of health savings. And of course, the women, they themselves decide on the interest rate. So that's it, I believe. This is the current outreach. So currently, this is Bandhan's only health outreach, 75,175 families of this particular project. Of course, they have other health programs. And since they have introduced adolescent girls, so that also includes 10,182 adolescent girls. However, there are more because Bandhan is also, they also have school health program. So where the girls are coming from other Gram Panchayat area, other areas, those are not been recorded here. So these adolescent girls belong to those families. And of course for ADS, they're covering 35,182 families. Out of that, 20,000 belongs to SHG members. So there are other members, non-members who are involved in this. So thanks for this. And of course, this has been a very brief presentation, and I have 2-3 questions to ask to Dr. Uttam and Mr. Sudhi. Probably take a slightly bit more time because Sudhir will be more comfortable speaking in his own language, and probably I'll try to interpret that. But first to Dr. Uttam. My first question is, why do you include adolescent girls in this project, particularly in the area of menstrual hygiene?
Thank you, Dr. Dutta, and thanks to you all. You know, the adolescent girls are the future mothers. So, it is certain that if they are aware about the reproductive health and safe motherhood issues, they will enjoy the self-motherhood. And you have mentioned that why we have included the menstrual hygiene for the adolescent girls. From our experience and from different studies, we have seen that menstrual hygiene management is a great problem, mainly in the rural communities. Which are the major causes of so many reproductive tract infections, which causing infertility, miscarriage, and even low birth weight baby. So, if the adolescent girls, the future mothers, are aware of the menstrual hygiene management, and if they practice it, of course, it will help them to restore better health. That's why we have included these topics in our health program.
Okay, my next question is, even there are questions from other, that's what I've heard. So the question, I put it this way: how do you prove that this project is a collaborative effort with the government rather than duplication of resource?
It's a common question to us. Our health model is almost similar to the government approach. We know it is very difficult for the government to reach in every household with their mechanism. That's why they are inviting the NGOs to take part in this effort. And we believe that our effort complements the government efforts for the betterment of the health of the community. That's why they are welcoming us to work with them. And they are inviting our staffs, field staffs, in the convergence meetings regularly, in the panchayat level and even in the block level. So that's why we think it is not duplicating the resources, it is helping the government effort for the betterment of the health of the nation.
And my last question is, what is the future plan in order to scale up, since this is a huge organization and